Is Aprendo con Nico, and today I intend to do a study session for my USMLE Step 1 preparation. So, we are going to study today the hallmark findings of many diseases on many presentations, and I'm going to read hallmark, and then I'm going to read the disease of the problem. So, abuminocytologic dissociation. This is present in Guillain-Barré. There is a markedly increased protein in CF with only modest increase in cell count. So remember that Guillain-Barré is a problem in the peripheral nervous system when people are going to get weakness or even paralysis of the extremities, and it's also because the presentation of the association with uh, agonists of GABA, I think. Yeah, antiplatelet antibodies, idiopathic thrombocytopenia purpura. Like idiopathic thrombocytic ITP is just bleeding, and you don't know like the cause, and maybe is the idiopathic ITP. Remember that Adam 13 is in uh, thrombocytic purpura, but I don't remember very well. And aranodactyly is in Marfan's. Marfan's is a problem with fibrin, is autosomal dominant, is going to present with long extremity, high stature, doesn't present with intellectual disability. Also, you're going to see aneurysm, you're going to see cardiovascular manifestation, mainly mitral valve prolapse, and also decepting aortic. Remember that in Turner syndrome is a 45 S0 and is most common in girls. Also, you need to know like uh, there is a biotic aortic valve, and then you're going to see like strike ovaries, lymphedema, Hortner kidney that is due to the metanephrine problems, and also the inferior mesenteric artery doesn't allow to the kidney ascent, and also in the Turner syndrome you're going to see like Weber neck. Good, but I was talking about Marfan's, and Marfan's also going to present with Petus scarbatum or Petus striatum. I don't remember the word very well, but it's like just that. Okay. Ashot's bodies is present in rheumatic fever. Rheumatic fever is can be present with Staphylococcus aureus, Streptococcus, yeah, and Streptococcus epidermidis. Also, remember that rheumatic fever can be present in children that old people, young people that went through teeth procedures and odontology procedures, because like the bacteria can go into the mouth to the superior vena cava and then to the tricuspid. Remember that the rheumatic fever is most present in the mitral valve, but in IV drug users is going to be present in the tricuspid valve. So uh, Arthroboris is like problems in the nails, also in the palms, also in the fingers, and etc. Rheumatoid fever is going to be diagnosed by the Jones criteria. Remember that the Jones criteria is like you can have two major criteria plus one minor, or three minors, or two minors and one major. I don't remember, but I know the criteria is uh, joint problems, carditis is going to be present with fever, also murmur, and just that. Our rod is an acute promyelocytic leukemia, and I don't remember the mutation, but I think it's 922 mutations. And our rods is very characteristic, it's very high yield, it's going to be present a lot. Our rods is like a neutrophy with a little bit of filaments. Okay, autosplenectomy. Autosplenectomy can be present in sickle cell anemia when switch a glug into a valve in beta chain. Also, in low oxygen increased cycling, aplastic crease with parvovirus B19. Parvovirus B19 is a single-strand DNA virus, and parvovirus B19 is also going to be present in scarlet fever. I know that Kawasaki is Coxsackie virus, and scarlet fever. I know one is Streptococcus, but I think scarlet fever is B19, and also it's going to be present with lymphoma. Good. Now, Salmonella, osteomyelitis, vaso-occlusive painful crisis, hydroxyurea as treatment, bone marrow transplant. Babinski is an upper motor neuron lesion. Remember that myasthenia gravis is present with upper and lower motor neuron lesion. So it's going to be present with spasticity, hypotonia. Now I'm trying to remember the myasthenia gravis versus Lambert-Eaton syndrome, and myasthenia gravis is due to autoantibodies against acetylcholine neurons, and Lambert-Eaton syndrome is against the calcium channels. Basophil splitting of red blood cells. There is present in lead poisoning. Lead poisoning is very present, and sometimes I don't remember the difference between lead poisoning and carbon monoxide poisoning. I know one is present with red face, also headache. Basophilic splitter red blood cell. Bain-Jones protein is present in multiple myeloma, free light chains, either kappa or lambda, Waldenstrom macroglobulinemia. Multiple myeloma, remember the M protein that is present. Biberg granulus, histiocytosis, eosinophilic granuloma, blue bladder, chronic bronchitis, at least 3 months for at least 2 years of excessive mucus excretion, or chronic recurrent productive cough. Bush-shaped heart. Bush-shaped heart is in tetralogy of Fallot. Tetralogy of Fallot is going to be present with right ventricular hypertrophy, alveolar aura, ventricular septal defect, and I don't remember the other one. Is cyanotic, present with in kids. I think it's going to be present in DiGeorge syndrome. DiGeorge syndrome is a problem with the thymus, the tear, and four pharyngeal pouches. Okay. Burchard notes osteoarthritis, proximal joint finger, bone to nearest deformity, rheumatoid arthritis, flesh proximal and extend distal IP joints, bone tumor, hyperparathyroidism. Burchard spots is in down. Down is a trisomy in chromosome 21. Down is going to be present with many diseases. I talk about it at Alzheimer, leukemia, Saint Chris. I also talk about the Nazi junction, and it's also another characteristic. But Downs is very high here. Cow Elsner bodies, granulosa cell tumor associated with endometrial hyperplasia, carcinoma, granuloma theca cell. Cardiomegaly with apical atrophy is Chagas disease. Chagas disease also is present in people that were infected with trypanosoma pavus, trypanosoma mansani in the South and Africa. Cancro, primary syphilis, cancroid, Haemophilus ducreyi, Charcot triad, multiple sclerosis, nigmatismo, intention, tremors, can speech. Charcot triad. Charcot triad is called lithiasis, isn't it? Like jaundice, right upper quadrant pain, and neutrophils, something like that. Fever. Okay. Charcoal-laden crystal, bronchial asthma, Chinese throat breathing, cerebral lesion, chocolate seeds, endometriosis. Endometriosis is going to be present also with dyspareunia, dysmenorrhea. Also is going to be present with anastomosis. Shops can sign hypocalcemia when you expand the muscle and you're going to see a spasm of the muscle or the fascia. It's going to be present in tetany. Clue cells is Gardnerella vaginalis. Clue cells, Gardnerella is a vaginitis and is different with Trichomonas. Trichomonas is yellow, yes. Clue cells is Gardnerella. Budgest is going to be Candida. Metronidazole is the treatment, and also I think in trichomoniasis you need to treat the spouse. Okay, Codman triangle, osteosarcoma. Osteosarcoma is associated with Paget's disease. Cold agglutinins, mycoplasma pneumonia, infection, mononucleosis. Cold agglutinins is present with mycoplasma pneumonia. Remember, mycoplasma pneumonia is not very present and is going to be like walking pneumonia when people are very okay, but the S-ray is very bad, and also think doesn't present with symptoms. Condylomata, secondary syphilis, new coffee flavor of vago. Syphilis is going to be diagnostic with the cardiolipin test. I think so. Coral Wilson spots, hypertension, ACA, cystoid body seen with lupus, yellowish cotton wool fondulation. Consumer bodies, dying hepatocytosis, hepatitis B. Increasing involvement capsule, rapidly progressing glomerulonephritis. Crescents. Oh, this is crescent. You're going to see crescent. Crescent is just B of the glomerulus of the Bowman capsules. Remember that post-streptococcal glomerulonephritis is going to be lumpy pumpy deposition, lumpy pumpy, and the Gaucher or IgA glomerulonephritis is going to be linear, yeah. And also Gaucher is type 2 hypersensitivity, and rapid post-streptococcus is going to be type 3, and it's going to be present in impetigo, infections, something like that. Conto dermatitis is a type 4 hypersensitivity. Current jelly sputum, Klebsiella, Kurzman spiros, bronchial asthma. Depigmentation substantia nigra, existing Parkinson. Parkinson, very high rigidity, tremors, is going to be present with a loss of dopamine in the substantia nigra. Par compactus is going to be present with Lewy bodies or alpha nuclein. Lewy bodies is also present in Lewy body dementia. Okay. De novo bodies, granulomas inguinal. Airbornation, osteoarthritis, polish ivory-like appearance of bone, Ectopia lentis, Marfan's. I talk about Marfan's, but Marfan is going to be differentiated from homocystinuria because they have overlapping features like the problem with the lung extremities, also the heart, but Marfan's is upward length and homocystinuria is down. Okay. Erythema chronicum migrans, Lyme disease is going to be present in 4 stages. One is going to be present with erythema and also joints problems and also heart problems. Fatty liver, alcoholism. Well, what do you need to know about that? That cirrhosis is present. Ferruginous bodies, asbestosis, iron leading. Gum focus complex. Tuberculosis. Tuberculosis is a problem with the CD4. Yes, this is CD4. T cells, macrophages. Macrophages are infected. They cannot fight against the bacteria. It's going to be present with sputum, fever, weight loss. Okay. Fatty liver. Fatty liver. Oh, ferriginous bodies. Asbestosis, I don't like it. Gum focus comes tuberculosis. Glitter cells, acute pyelonephritis. Pyelonephritis is most common with E. coli. Also, fever, vomiting. Also, just that, I think. Gower maneuvers is the Duchenne muscular dystrophy use of arm to stand. This is high yield because muscular dystrophy or Gower signs is a S-linked disorder, and is when the kids put their hands in the floor to stand, and also is going to be differentiated from other disease. Heberden's notes, osteoarthritis. Hans body, GCPDH deficiency. Is going to be person with infections. Erythropoiesis antibody infection mononucleosis. Infection mononucleosis, that is the Epstein-Barr virus. Single strain DNA virus is antivirus. Hydronobodies is Alzheimer's. I never saw hydronobodies. Hypersegmented polymorphonuclear neutrophils is a megaloblastic anemia. I talk about megaloblastic anemia. There is present with the B12 deficiency, folate deficiency, hypersegmented neutrophils. Talking about Alzheimer's, you need to remember that Alzheimer's is in all patients with declined memory. It's going to be present with crescent. No, it's going to be present with atrophy as the third ventricle. Also present with a beta amyloid protein, precursor beta amyloid protein. And yeah. Hyperchromy microcytosis red cells, iron deficiency anemia or beta thalassemia. Iron deficiency anemia is present when a person is going to losing blood, and is going to be present in young girls, like heavy menstrual periods. It's going to be present with increased ferritin, no, decreased ferritin, increased transferrin, and decreased total binding capacity, increase. It's going to be present also with chronic infection or inflammatory problems. Haddish Hernes reaction syphilis over aggressive treatment of an asymptomatic patient that caused symptoms of secondary to epilepsy. John mysis, osteoarthritis fracture, osteophysis. Asthma on breathing. Diabetic ketoacidosis. Diabetic ketoacidosis is going to be present with acidosis, low pH, high. It's going to be present with high bicarbonato or low. I think it's low. And asthma on breathing is when you see like, yes, and also you're going first to do like IV serum, and you're going to check potassium. What else? You need to differentiate it from the hyperglycemic state that is very glycemic high. Okay. Kieser Fisher ring, Wilson's. Oh, this is presence in the eyes. Keratin powers. Squamous cell carcinoma of skin, actinic keratosis is a precursor. Kisman-Till Wilson nodule, diabetic nephropathy. Yes, I cannot remember. No, I need to remember this. Diabetic nephropathy, nodular glomerulosclerosis, nodule mensaje matriz. Kailositus, HPV 6, 11, condyloma acuminatum benit, en HPV 16, 18, malignant association. Complete spouse, mallets, Lewy bodies, Parkinson, eosinophil exclusion damage substance in English cells. Hey, I talk about that. Leach nodules, neurofibromatosis, bone, Recklinghausen's disease, pigmented hematomas. Oh, Lynch nodules, neurofibromatosis. Neurofibromatosis is a autosomal dominant disease. It's going to be present with neurofibromatosis type 1, neurofibromatosis type 2. It's a problem in the chromosome 15, yes, and man is 17. Also, neurofibromatosis type 2 is going to be present with schwannomas. I think so. Lumpy Pumpy. Hey, if glomerular. Post-streptococcal glomerulonephritis. Prototype of nephritis syndrome. I talk about that. Remember the difference between nephrotic and nephritic. Nephrotic is a problem with the podocyte of the glomerulus, and they're not like the glomerulus is not able to function well, so you're going to present with high protein, also proteinuria and edema. In nephritis is going to be present with hematuria, like infection, fever, Mallory bodies, alcoholic hepatitis, Mac-Bunny sign, appendicitis. Mac-Bunny point is 2-3 of the way from the umbilicus to enter the superior iliac spine. Okay, Mac-Bunny is in the right. Robinsky is in the left. Michaelis Goodman bodies, malakoplakia lesion of bladder due to macros, and corsaphides bodies, usually due to E. coli. Monoclonal antibody spike, multiple myeloma. This is called the M protein, usually IgG or IgA. I talk about the M protein. Myxedema, hypothyroidism. I thought myxedema was Graves' disease, but anyways. Lewy bodies is in rabbits. Neuritic plaques is in Alzheimer's. Neurofibromatosis is in Alzheimer's as well. Not pitting edema, myxedema, antatoxins. Notching of ribs, coarctation of aura. Coarctation of aura is going to be present with a heart, a big heart, going to be present in Marfan, and is going to be present with different pressure or the blood pressure in the extremities. Also, subclavian syndrome, still subclavian syndrome is also present with that. Nuclear liver is in chronic heart failure causing congested liver. All L cells, cytomegalovirus. Bro, that is very characteristic, the cytomegalovirus. And OPS I cells is like a cycle. It's present in brain, stomach cells, Hodgkin lymphoma, archer cells seen with rheumatoid fever. Painless jaundice. Is pancreatic carcinoma. Pancreatitis is going to be present with with pancreatitis is going to be present with, it can be present with fever, but mainly with abdominal pain. Also, it can be present with shock. And also, you need to remember the cause of pancreatitis. I get as much. Idiopathic, medication, gallstone, alcoholic. Gallstone very, very high. Pants, rheumatic, rheumatoid arthritis. Also see morning stiffening that decrease with joint usage. Late DR4. Poutres microabscess. Mycosis fungoides cutaneous T-cell lymphoma Caesar. Philadelphia chromosome 922. Chronic myeloid leukemia. Philadelphia chromosome. Chronic myeloid leukemia. Peak bodies in peak disease. Peak disease, peak bodies. Peak disease is a problem with memory. I think it's going also person with, like problem with the person going to be very aggressive. Two types of COPD. Pink puffer is a type 1, as type A, emphysema. Blood blotter, type B, bronchitis, emphysema. Central acinar is smoking, and panacinar is alpha-1 antitrypsin deficiency. COPD is characterized by decreased residual volume and forced volume 1 capacity. Podoga, gout. Gout, person with breastfeeding, also with history with shunting oxidase, allopurinol, gout has joint pain. Port wine stain hemangioma. Posterior anterior drawer sign, tearing of the ACL. Sanoma bodies, papillary adenocarcinoma of the thyroid, pseudopapillary cystoadenocarcinoma of the ovary, meningioma, mesothelioma. Pseudohypertrophy seen with Duchenne muscular dystrophy, the calf muscle due to increased fat. Punch-on bones lesion, multiple myeloma. Rash on palms and soles, secondary syphilis, Coxsackie virus infection, hand-foot mouth disease, and also, I don't even know what is this. Red morning urine, paroxysmal nocturnal globinuria. Also remember the hematology association with PNH. Remember always that the ventricular septal defect, the arterial septal defect, and the patentus arteriosus is always left to right. Because if right to left, it's going to be cyanotic. It's for heart sound, pulmonary stenosis, pulmonary hypertension. S for remember hypertension, remember cardiomyopathy, Schwann's reactions, Neisseria meningitis, impressive rash with back, meningitis with rigid neck, also fever, confusion in kids. Remember Neisseria, streptococcal, and I think Haemophilus is in kids. Smith antigen, lupus, also anti-dsDNA, anti-Smith is most specific, but anti-dsDNA is more sensitive. Malar rash, war loop, kidney lesion, joint pain, false positive syphilis test, BDRL, 90%, 15-14 young males. Also seen with use of NIH, prochymanate, hydralazine. Okay. Oh yes, hydralazine is like you can see drug-induced lupus. Cell bubble on X-ray, germ cell tumor of bone. Spike in dung glomeruli, membranous glomerulonephritis, nephrotic syndrome. Spike, basement membrane material and dung, immune complex deposits, IgG or C3. String seen on X-ray, Crohn's, bowel wall thickening. String seen on X-ray. Crohn is a transmural, but ulcerative colitis is crypt abscess, but Crohn's is clubstones. Target cells, thalassemia, in alpha thalassemia with no alpha gene, hydrocephalus, intrauterine death association, Ebert-Bards. Now, tendinoxantomas, familia hypercholesterolemia. Tendinoxantomas, system xantomas in the eyes, in the face, in the palms, and also is going to be present with LDL receptors problems. It's going to be present with pancreatitis, heart problems, cardiomyopathy, I think. Periodization of the kidney, chronic pyelonephritis, toffee, gout, negative beach feeding. That was what I tried to remember. Trunk tract glomeruli, membranoproliferative glomerulonephritis, nephritic syndrome, basement membrane is duplicated into 2 layers. Threshold SAM, visceral carcinoma, classic pancreatitis, migratory thrombophlebitis, hypocalcemia, carpal tunnel. You remember that the other sign of hypocalcemia? This is result sign. I think it's Chavask. Virtual node, supraclavicular node enlargement by metastasis or carcinoma of the stomach. Warding Finkelder-Jean cells, measless. White blood cell cast, pyelonephritis. Whipple's triad. CNS dysfunction, hypoglycemic episode, glue injection reverse CNS symptoms, wire loop glomeruli, lupus nephropathy, type 4, diffuse proliferative form. Increase AFEP in amniotic fluid or modest serum, spina bifida, and encephaly. I think AFEP is decreased in Downs and also Patel or Edward. Increase uric acid, gout, Leishman, Semutillarian behaviors, also sphingomyelin deficiency, myeloproliferative disorders, direct lupus osteosis. Decrease FEB1, FBC is in PD. Ground glass on chest X-ray, hyalin, due to pneumocystis carini seen with atelectasis. Honeycombing of the lung, seen with asbestosis and restricted lung disease. Crescent Guspachur syndrome, pneumonia with hemoptysis, rapidly progressive glomerulonephritis. Guspachur is type 2 hypersensitivity. Is crescent linear EG deposits. Linear Guspachur is what I said. Guspachur is linear and lumpy pumpy is streptococcus. I don't know why this is not like charging. Crazy, right? Okay, I'm going to see if it's charging. Okay, not now. Wait a minute. I'm going to see if now it's charging. Because not even like just losing that much. Okay. For the green branch point, aspergillosis, past positive Duchenne bodies, Waldenstrom macroglobulinemia, EGN hypervicosity, ground glass in abdomen hyalin seen in hepatocytes or healthy cories of HB surface antigen in the liver biopsies. Sidney cells that replace the ovaries due to Kluburger tumor that has metastasis from the stomach. Ground glass appearance, hyalin, seen with progressive multifocal leukoencephalopathy, oligodendrosis. Nucleus seen in papillary carcinoma of the thyroid. Congo red shows amyloid deposition in place and vascular rods. Amyloidosis. Bro, it's not charging at all. Tuberous sclerosis triad. Seizures, mental retardation, leukoderma, congenital fascia, while exposed, or maculas, angiofibromas. Could include sim with herpes simplex encephalitis in oligodendroglia, Debye syndrome, neuromyelitis optica, a variant of multiple sclerosis, rapid demyelinization of the optic nerve, and spinal column with paraplegia. SERB2, Breast Cancer Association. Foster Kennedy syndrome, a tumor causing blindness and loss of smell with papilloedema. Smell is in Calmo syndrome. Hodgman sign, flicking of the middle fingernails. Red nucleus destruction, intentional tremors of the arm. Ventral spinocerebellar tract, unconscious propulsation of lower extremity. Dorsal spinocerebellar tract, unconscious propulsion of fine motor movement. Cuneus cerebellar tract, unconscious propulsion in fine motor movement of the upper extremity. Dorsal columns, conscious propulsion of the body. Lateral spinothalamic tract, pain and temperature sensation. Ventral spinothalamic tract, light touch perceptions. Lower motor neuron lesion, Wending-Hofmann progressive infantile muscular atrophy, poliomyelitis, sensory pathway lesion, subacute combined degeneration, Friedreich ataxia, B12 deficiency, Teves dorsale, neurosyphilis, both upper motor and lower motor neural lesion, acute lateral sclerosis, low brain disease, both sensory motor lesion, Brown sequard, anterior spinal artery occlusion, subachiasmatic nucleus, control circadian rhythm, ventromedial nucleus, satiety center, savage behavior of obesity when lesion, lateral nucleus, induced eating, starvation when lesion, arcuate nucleus, release PIF dopaminergic units, mammillary body can have hemorrhage, as in Wernicke encephalopathy, acanthosis, red blood cells, spinal projection seen in abetaloproteinemia. Okay. That's all regarding the Hallmark. Hallmark is a little bit hard, right? But it's that. So, that's all.